Hi everybody, and welcome to our next module where we will be covering the anatomy and positioning for the abdomen. We will be covering the digestive tract in this module. Think of the digestive tract as the tract from the mouth all the way through the rectum. So we need to learn what's in between that area. To start, the digestive tract has 6 organs within that digestive system. We have the oral cavity, the pharynx, the esophagus, the stomach, the small intestine, and then the large intestine. Some accessory organs that we have are going to be the liver, the pancreas, and the gallbladder. This picture here is just showing you again those accessory organs of digestion. Bigger, showing where the liver, the gallbladder sits behind, the pancreas, and then the spleen you'll see here, but the spleen is not an accessory organ of digestion. So we already kind of covered the upper digestive system portion in our chest, looking at the oral cavity, the pharynx, and the esophagus. So now we need to start at our stomach area, which then goes into our small intestine. That small intestine is going to be roughly 15 to 18 feet long, and it's going to be divided into 3 different parts. We have the duodenum, the jejunum, and then the ileum. The valve between the ileum, which is the end of the small intestine, where it joins the large intestine at the cecum, is going to be called the ileocecal valve. Moving on to the anatomy of the large intestine. So the large intestine roughly begins in the lower right-hand quadrant at that ileocecal valve. The portion of the large intestine below that ileocecal valve area is a sac-like portion named the cecum. On the cecum, you're going to find the appendix, which is attached to the posterior medial aspect of the cecum. The cecum then leads into the ascending colon, which joins the transverse colon at the right colic flexure. So we have the cecum, ascending colon, right colic flexure, or hepatic flexure. It is then going to go into the transverse colon across the body, leading into the left colic flexure or the left splenic flexure, going down the descending colon, which then goes into the sigmoid colon, S-shaped portion of the colon, the rectum, and then the anus. So this picture here, looking at this picture on the left-hand side, we have the diaphragm, and then we have muscles called the psoas muscles. The diaphragm is that umbrella-shaped muscle that separates the abdominal cavity from the thoracic cavity. And then we have the psoas muscles, which are going to be located on either side of the lumbar vertebral column. So again, here's just a diagram of it. The diaphragm with the psoas muscles. If we were looking at an x-ray, diaphragm would be sitting here, separating the thoracic from the abdominal cavity, and then the psoas muscles are going to be laying on the outside of the lumbar vertebral column. And you will see those on every single abdomen x-ray. So with abdomen exams, we will be looking at the urinary system for some of these exams. So for example, a patient who has kidney stones, they will solely be looking really at that kidney, ureter, bladder area on that x-ray. So the urinary system does consist of 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. The 2 adrenal glands of the endocrine system are going to be located at the superior medial portion of each kidney, which you can see in this picture here. And then something to note, the right kidney is typically situated a little bit more inferior than the left kidney due to the presence of the liver sitting right here. This image in front of you is showing you an exam called an intravenous urogram. These are kind of slim to none performed in the department anymore, but it really just visualizes the urinary system with contrast administered. So as you can see, both kidneys are lit up with contrast, both ureters are, as well as the bladder, just to show you the anatomy a little bit better. So just to go back to review a little bit more in depth those accessory organs, we have the liver, which is located in the right upper quadrant. It does have numerous functions, one of which is the production of bile that assists in the breakdown of fats. We have the pancreas, which is going to be located posterior to the stomach near the posterior abdominal wall, located usually roughly between the duodenum and the spleen. The pancreas is a part of the endocrine system. It produces the essential hormones such as insulin. It also produces large amounts of digestive juices that are more to the duodenum through a main pancreatic duct, which is used for digestion. We then have the gallbladder, which is going to be the pear-shaped sac located posterior and inferior to the liver. The gallbladder contracts and releases the stored bile when stimulated by an appropriate hormone. Something to note, it cannot be visualized without contrast media. And something you guys might see actually on an x-ray is the presence of gallstones within that gallbladder, and that is going to be called cholelithiasis. So looking at the abdominal cavity, we need to know all of the layers within the abdomen, and then how are some of these organs connected to our body so they stay in place. We have the peritoneum, which is going to cover most of the abdominal structures with a large serous double-walled sac-like membrane. The mesentery is going to be a double fold of peritoneum that loosely connects the small intestine to the posterior wall of the abdomen. The omentum can be broken up a little bit. It's going to be a specific type of double fold peritoneum that extends from the stomach to another organ, which then we have the lesser omentum, which is extending superiorly from the lesser curvature of the stomach to portions of the liver, and then the greater omentum connects the transverse colon to the greater curvature of the stomach inferiorly, which we can see in this picture down here. The mesocolon is going to be the peritoneum that attaches the colon to the posterior abdominal wall. And then lastly, the greater sac is just commonly referred to as the peritoneal cavity. So these pictures in front of you just showing you different views of how we can see our intestines being connected to one another. This picture in front of you is breaking up the organs into 3 different categories: retroperitoneal, intraperitoneal, and infraperitoneal. So if we start with intraperitoneal organs, those organs are going to be within the abdominal cavity that are partially or completely covered by some type of visceral peritoneum. Those are liver, gallbladder, spleen, stomach, jejunum, ileum, cecum, transverse colon, and sigmoid colon. Retroperitoneal organs are going to be organs attached to the posterior abdominal wall. Those are going to be kidneys, ureters, adrenal glands, pancreas, the C loop of the duodenum, ascending and descending colon, the upper rectum, and then our major abdominal blood vessels. Infraperitoneal organs are going to be located under or beneath the peritoneum, and those are going to be the lower rectum, the urinary bladder, and our reproductive organs. So the abdominal area is broken up into 4 quadrants. We have the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. I think your biggest takeaway for this picture is really kind of knowing what organs are laying within these abdominal quadrants. So, for example, liver, right upper quadrant; stomach, left upper quadrant; left lower quadrant would be kind of like the sigmoid colon, say. Right lower quadrant is where our appendix is, for example. So make sure you just can be able to label all 4 of these quadrants. Now we're going to look at the 9 abdominal regions. So now we're breaking it up even further to 9 different regions. This really isn't used too much now in radiology, but you do still need to know all 9 quadrants. So we have the right hypochondriac region, the epigastric, and then the left hypochondriac region. Moving down to the middle, the right lateral, the umbilical, and the left lateral. Moving down to the bottom, right inguinal, the pubic area, and the left inguinal. So again, just memorize these. Some topographic landmarks you need to remember are the xiphoid process, T9, T10, the inferior coastal margin is going to lay at L2, L3, and then the iliac crest is going to lay roughly at L4, L5. So this picture is showing you some more topographic landmarks of the pelvis area. When we learn to position for the pelvis, we will be using palpable landmarks located on the pelvis. Ones that we will be using to palpate on a patient will be the crest of the ilium, the ACIS, and the greater trochanter. Technically, the pubic symphysis and ischial tuberosity are palpable, but we clearly will not be palpating those on a patient. So again, these are topographic landmarks of the pelvis. I will show you these in lab, how we will palpate for them to position for a abdomen exam. And that's it for today's lecture on abdomen anatomy.